Okay. So the female of 43 years age was admitted in hospital, and her relative called me via phone. And actually, this whole family is already my patient, and over phone they narrated all the case. They were in mandir and having bhajan kirtan, and all of a sudden, this patient, this lady, fainted and started convulsing. So they, after a while, took her back to the home, but her condition was getting worse, so they admitted her in hospital. And their investigation was done, and in MRI, it was shows the left putaminal bleed. There was the lacunar infarct in right capsule ganglionic lesion involving just a minute, right corona radiata. There's hypotensities in bilateral periventricular white matter ischemic demyelinating. So it's a clear-cut case of the cerebral infarct. I asked about the presenting symptom that what she was having that time. So there was the complete right side paralytic condition. She was not able to move her right side as the infarct in left side of the brain. Patient is in semi-comatose condition. If forced to ask any question, she answered, but then again went to semi-comatose condition. She was speaking with lot of efforts because of the tongue paralysis. There's lot of ghabrahat, lot. She is constantly moving her left side of the body. She was like not liking any touch. She didn't like to talk anyone, even the close one. I tried to ask about the conflict. What was the cause that led her to this condition? But nothing I found, because the patient is not in the condition of answer anything, and the relatives did not know anything about it. So, on behalf of this short history, I took the rubric and medicine was prescribed. So, rubric was selected, that is anguish from the mental chapter. Second is the cerebral hemorrhage from the head chapter. That there was the thirst present for the last quantity. So the rubric was thirst last quantity for, and the infarct in the left side of the brain, so selected side left. And the medicine was given on the case, that was the Aconite 1 ml single dose. And after 1 hour of it, Arnica 1 ml TDS only for a day was given. And after 12 hours, the patient relative again called me and said there was a remarkable change. The patient is now able to move the right side of the body. Now speech is clear. Even their allopathic doctors was also amazed that they had never seen such cases improved in such short span. So after 24 hours, the patient is discharged, and the medicine was given is Sacalef only for 3 days, and then repeatedly given Sacalef for further 7 days. So totally for 10 days, Sacalef was given. And now patient is at home. So here the patient is now free from frank syphilitic miasm, and now it's my turn to resolve the infarct and select the GCS, the genetic constitutional similum, that will help her. So for this, a full case taking was done. That time she was passing at home. That time she was passing urine via catheter. There is no sensation when she was passing urine. Stream is very slow. She had not passed stool since 2 days. There's no urging. Appetite is weak. She still didn't want to talk. And also when she tried to speak, there's a tilted mouth toward the left side. And I asked about that if she remember any conflict or other mental trauma she tried that time, but nothing she remembered. Only the thing she remembered is that she was playing dholak that time and suddenly she fainted. Her physical general was the appetite is normal. She cannot tolerate hunger. She likes warm foods. She has no specific desire for specific taste. Thus was thirstless. She does not require much water. Actually, when she was suffered, she desired water, but in general constitutional, she is thirstless. Thermally chilly, perspiration normal, startling is present, and speed is fast. No any physical sensitivity is there. Her menstrual history, she had her last menses 1 year ago. She was dysmenorrheic, and also there was a history of infertility treatment. On asking about her nature, She is reserved in nature, used to speak few words only when needed. She likes to live alone. She had very few circle of friends. She is very angry in childhood, but used to express anger now as the age is growing. And she does not like to talk. Sometimes she abruptly cut the talk without answering. She likes that everyone should obey her. If someone contradicts or does not obey her, she feels angry and hurt. She is very religious person, very duty bounded, very responsible, like to do things for everyone. She is five siblings, and she is among third one, and still she used to do much for everyone. If something she not able to do or something mishappen, so she felt like she had not done something well, or all the blame is of her. She is very brainy, can do multiple tasks at one time. She used to weep on the other suffering. She feels pain of others. She is very anxious person. So on this history, the rubrics was taken and the medicine was prescribed. So rubric was that company aversion to solitude, fond of. Second is reproaches himself. Third is sympathetic, compassionate. Next is side left and the responsibility strong. And medicine was given aurum met. So 23rd Feb, aurum met 200 single dose was given, and with the following sequelae for 7 days. The follow was at 28th February, like now there is no pulling of left side of the mouth. Stool was passing alternate day, and there is urging for urine. There is sensation present while passing urination, followed by sequelae for 21 days. 24th March of 2022, there is body pain when she exerts. There is urine normal, stool passing regularly, but there is hardness when she passing stool. Still, I gave SL. Nothing, no doses required that time. Next follow is 24th April. There is no body pain, appetite good, no physical symptoms. Yeah, ma'am. Stool and urine passing, everything is normal. So a Saclac is given for a month and asks patient to for the new MRI report. And in 28th May, the patient came with a new MRI report that shows the resolved parenchymal hematoma, and the case is completely cured. Patient is completely normal. So this is the case that I realized that homeopathy can do miraculous result in the acute condition, as well as if we give GCS followed by, then it can cure the case completely. Thank you.
Very nice presentation, Dr. Surabhi, and all the best wishes for your bright future. Next presenter is Dr. VIBHA MEVADA. She's from Indore, and she's going to present a case of PCOD.
Okay, so good afternoon, all of you. Thank you so much for giving this platform for all of us for presenting our cases. So without wasting time, I just like to start my case. So dear all, my case is about the PCOD, which is an documented and cured case. So the case is of a 21-year-old female who is pursuing her CMA. She's a student and a non-vegetarian person. So she consulted to me on 3rd July 2021 with the USG report, which is given there on your screen, where it's clearly presented that a small clear cyst in the right ovary is there, and the multiple small 2 to 6 cysts are there in both the ovaries. Right? So let's start with the chief complaint, how she started with me. The first complaint what she presented to me is about the oligomenorrhea, that is the irregular menses are there since last 7 months. She's like menses appear in the gap of 1 or 2 months. It's not regular every time. After the periods, when the 4 or 5 day is over, the spotting is still remain for the next 8 to 10 days. She's like the bleeding is sometimes very scanty, sometimes very heavy bleeding is there. The stomach is ache, this is unbearable for her. She always used to take the painkiller. She's like before and during the menses, my breasts are very heavy. Other complaints including this, she have a headache which is there for since long. She's like after the vaccination of COVID, the headache is very frequent now, which is ameliorated after vomiting only, and after long reading, the headache is aggravated. Other complaints, she have leg pain as she come to me with the report of USG. She was consulted to some gynecologists before me, and according to them, the leg pain is there because of the calcium deficiency. So when I proceed the case and ask about her nature, she's like, so doctor, I like to do the creative work, the paperwork, room decoration, clay work, and I feel like I should be very good in all these things because I like to do that. But she is like, I'm not perfect in all these things. I'm not perfect in my craft. I'm not perfect in my dance. In lockdown, specifically, she mentioned that in lockdown, my routine is completely changed, and this is the thing which is bothering her a lot. And how the thing is bothering her, she's like, I'm feeling inactive because my routine is completely changed now. I doesn't I love to chit chat with my friends. I love to be with my friends, which is not there because of the lockdown. So basically, when I prop this point little bit more, she explained that basically what happened in the lockdown, my routine, my schedule, my college time, my this time, my tuition time, everything is changed now. So this is the thing which is bothering me. I was like, okay. So it affects her work, because she said my work are delayed because of that, which I dislike the most. I want always my work should be on scheduled time only. On the other point, she discussed about her relationship, which is there since last 6.5 years. And she's like, I'm in a long relationship, and still, if I feel hurted about anything or get anger about anything, I'm unable to speak up or share this thing to my boyfriend. She's like, if I feel low in myself, I used to cry, and after crying I always feel better. The improved routine also make me feel the good. When my routine is on very time, scheduled always, itne baje ye karna hai, itne baje ye karna hai, then I feel very good. She's like, I feel deficient in myself skill wise. And she's like, I sometimes I have doubt on myself that I can achieve something in my life or not. She have a very low confidence as when she consulted to me first time, she gave some job interview that time. So she's like, when I saw so many people in that room for the interview, I feel the low confidence in myself. So she's like, I got that fear of interview and competition with this so many people, those who are seated there already for the for preparing for the interview actually. She's like, basically, I'm a very sensitive, I'm a very sensible person, and I can cry very easily. And what are the things which make her cry very easily is about the family issues. She's like, I'm badly affected by family issues, especially with the mother. She's too much attached actually. And all these things, this family issues and something if happen in the family, it make a negativity developed in me. I feel more low confidence. I used to cry in alone at that situation. In this COVID, she lose her paternal uncle to whom she is very close actually. So she's like, this pain is unbearable to me that I lose my uncle. I can't expect that. I can't, she is not accepting that she lose someone which is very close to her from the family. Other thing, she have a habit of nail biting. She used to write poems every time whenever she come to me for follow up or anything. She used to read that poems to me always. She's like, I'm very 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 anxious about my mother's health, especially whenever my mother got ill, or if she get fever, cough, or anything, I got sick physically and emotionally. She's like, I tried to give very positive vibes to my mother, but it not work that much actually, and I affect majorly by her health. During anger, she sweats cold. Her heartbeats get fast. Body started shivering from the inside. If we see about the family history of this patient, she have that paternal and maternal history we have here. So paternal grandfather have asthma, grandmother have angioplasty and hypertension history. This was about the paternal history, family history. When we see about the maternal family history, she's like, my mother has some heart problem and she is hypotensive. Grandmother had paralysis. One uncle also have paralysis. Other five aunts are there. Out of them, the second number one also have DM. The fifth number is obese. Okay, so this is about the family history. When I inquire about the generalities of the patient, she desires four number means highly desire for the sour things, for chicken, some milk products. She avoids cooked tomatoes specifically, and cauliflower. She is thirsty. Not much thirst is there. Hardly 2 liters a day she used to have water. Thermally, she is hot. About the urine, she explained that I can control for the long time. And in the past history, in the childhood, she have the bedwetting history when she was in the sixth standard. She perspire on forehead and occiput. The odor is very high, and there is no stain of the patient is there. About the sleep, she said, I talk during sleep, and that's my family problem because in my family, so many people are doing the same thing. About dream, she have no any repeated dream, so I can mark for presenting the case. She rarely had any dream, and if she had rarely had any dream, she can't remember anything, right? So this is the case of today, and what I understood mathematically about the case is the case predominantly is presenting the psychotic miasm. And what is the reasons for when I'm saying it's a predominantly a psychotic miasm case? The first thing, the pathology itself, the overgrowth, the cyst we can consider as an overgrowth. The cyst is there, lack of self-confidence is there, hurt but can't express. All these things we can understand about the the idea about the miasmatic understanding of the case. Let's see about the analysis of the case. So what are the important things, the PQRS things, what I got in this case is first thing, the change of routine aggravates her. Other thing, the lack of self-confidence is there. She is very family oriented, the death of uncle, the health of mother, the issues in family affect her very negatively. She is very anxious person. When she is angry, the cold sweat is there. She desires very highly for the sour things. She averts specifically for the cooked tomato, and very odorous perspiration is there. When I put all yeah. When I put all these things in the repertory chart, so these are the rubrics what I selected here, and here is the repertory chart. So as we see, all the important rubrics from physical, mental, generals are covered with the Kali carb here. So no doubt my prescription was Kali carb for this patient. For the material medical reference, I always try to read the soul of the remedies first. So when I read about the Kali carb, it's a psychotic remedy, a mineral remedy. The main feeling, the vital fear of the reaction is the part of the carbon, and the support and the lack of support of family and group, all this thing there, which is the main thing of the Kali family actually. Other small things also we can get from other material medicas about this case. So yes, the prescription was Kalika 1M with the SL for next eight weeks. After 2 months, in the first follow-up, what I got on, she got the menses on the 10th of the September. The bleeding was properly started. Uh, on the 5th September to spotting is there. On 18th September, again spotting started and stopped on the 21st September 2021. There is the major changes what we got in the first follow-up is that there is no stomach pain was there. The brownish color at the starting and at the end of the color changes what she explained about this menses. What is the main thing about the first follow-up is that this month was peaceful according to her. The confidence, what she, the major thing, the lack of confidence was there. She feel the confident in herself. She's like, I'm not feeling that much tense now about family, about anything, and means easily taking the responsibility of mother. So in this month again I repeat the same medicine with the same potency again for the 8 weeks. After the 4 months follow-up, there is no spotting after the 5th day, and the heaviness before and after before and during menses is there, right? Again, repeat the same medicine with the same potency for the next 4 weeks. And after the 6 months, there is no symptoms are there, no any significant symptoms is present there, uh, which is we can see here in the before and after report of this particular patient. First report I've already shown in the initially when I started the case. After 6 months on 25th of Jan 2022, there is no significant abnormality seen in the USG report of this patient. So this is about my case of today. Thank you so much for giving this platform and opportunity. I heartily thankful to Shikhar Gunde sir and the team. Thank you so much.
Thank you so much, Dr. Vibha.
Thank you, ma'am.